Hello and welcome back. My name is Ray Upchurch and you're watching the Trey Heart Learning Channel. Today we're going to be talking about auscultation of the heart. Please be aware that this will not be a complete assessment of the chest wall area, but will only cover the auscultation of the heart. So, what things will you need? Well, you will need a quiet, well-lit area. The reasons for this is this eliminates any external noises and allows the assessor to better inspect the patient while providing the patient with a warm environment. Secondly, you need a disrobed patient, at least to the areas you're going to auscultate. Third, you need the ability to examine the patient in 3 positions. These positions are sitting, lying on the back, and turned to the left lateral assessment position. Most examination couches should facilitate this. Fourth, most books suggest that you examine patients from the right side. The reason for this is that with your stethoscope, this usually stretches your stethoscope completely. But this is not absolutely necessary that you examine the patient from the right side. Fifth, you also need the stethoscope. Your stethoscope should have the bell and the diaphragm. If your stethoscope does not have both of these, it should have the ability to listen to both of these assessment points, such as some of the electronic stethoscopes have. If it doesn't have both of these, then you need to change your stethoscopes. Sixth, there's 4 areas that minimally need to be listened to. These are the aortic, the pulmonic, the tricuspid, and the mitral. Now, in the next section, we're going to talk about where these are located and how these are better located. One of the best ways to assess the heart is to do it in a way that's consistent each and every time. So I teach a specific way to do it, but however, if you've learned to do it a different way, that's okay. The main thing is to remember to do it the same way each and every time. That way you get these consistently down. So first off, I'm going to start with the aortic, then the pulmonic, then the tricuspid, then the mitral valve. And the best way I do this is by learning a mnemonic. My mnemonic is you got to learn your anatomy and physiology before you know where the tricuspid and mitral valve are. So if you take that mnemonic, the anatomy and physiology, meaning the A would be aortic, and then P would be the pulmonic, and then of course I mentioned the tricuspid and the mitral valve. So how are we going to find these? Well, on your disrobed patient, the best way to do these is to locate these positions is to listen to or to put your hands on the patient's chest and find the intercostal space. Now, the intercostal space are the spaces between the ribs of the patients. The first one we talked about was the aortic valve. The aortic valve is the second intercostal space just to the right of that patient's heart, of that patient's sternum. So what we do is we go down and we find in the middle of the patient, you can do this on yourself, you can find where your sternum comes to the top, then you find a little notch. This notch is called the angle of Loess. Just to the right of this notch, you should find the second intercostal space, and that is where the aortic valve is best auscultated. That's where you want to place your stethoscope. So you listen to that place first, and then exactly opposite on the left-hand side of the heart is the pulmonic valve. The pulmonic valve is also in the second intercostal space, just left of the sternum. So that's your second place that you listen to. The third place that you listen to is the tricuspid valve. Now your tricuspid valve is what some books say is the left lower sternal border, otherwise known as the fourth intercostal space. So you just count your 2 more intercostal spaces down. You're at your fourth intercostal space. You're at the tricuspid valve, or at least where the tricuspid valve is best heard. Once you listen to the tricuspid valve, then you move on to the mitral valve. The mitral valve is your 5th intercostal space, then mid-clavicular line. So this is in between your clavicle and your neck. Straight line down is where you're going to find your 5th intercostal space. So this is where your mitral valve is. So you do that first with your diaphragm of your stethoscope, and then you go back over them with the bell of your stethoscope. You do this, as I said, in 3 positions. The patient sitting, preferably sitting forward, as this brings the heart forward into the chest. Then lying back flat on the bed, and then in the left lateral position. The best 2 places for listening to heart auscultations are either in your sitting forward position or in your left lateral position. But it's very important to use all 3 because the heart does change position ever so slightly when you use them, and you can hear some sounds better. One of the things that I try to encourage people to remember is that this is where the heart sounds are best auscultated. It's not necessary where the heart valves are located, as we demonstrated in the previous videos. So go over this again and again, and be sure and get your placements down. Remember, second intercostal space, right side of the sternum, aortic. Second intercostal space, left side of the sternum, pulmonic. Fourth intercostal space, left side of the sternum, tricuspid. Fifth intercostal space, mid-clavicular line, lower on the sternum is your mitral. Listen to all of those areas and do it in all of those positions. Then you will be able to assess the heart sounds of your patients. Well, I'd hope to have a little video to show you of an actual patient auscultation, but I don't have that. But practice this technique and get it down. And the next time, we're going to go over the heart sounds and how they're formed, where they come from. So stay tuned. I'll see you then.